Hello and welcome to my channel. Today, we're going to give to you 10 answers to the biggest mental health questions out there. At the beginning, I'll present the content of this video. We're going to explain to you what mental health is and what mental illness is, and how you can tell if someone has a mental health problem. But if you are feeling down, the best advice I can give you is to go seek out the help of a professional medical therapist. We'll also be showing you exactly what to do in the case of an emergency. In addition, we'll explain to you exactly what it means to be sectioned, and what a personality disorder is, as well as how to talk about post-traumatic stress disorder, or PTSD. I'll try to give you the best ways to improve your mental well-being. Finally, I'll tell you if there are any drugs or therapies that might be better for your mental health conditions. Each piece of information in this video has been researched and scientifically proven. We highly recommend watching it until the very end. Number 1. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Many factors contribute to mental health problems, including biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, and family history of mental health problems. Mental health problems are common, but help is available. People with mental health problems can get better and many recover completely. A mental illness is a broad term which encompasses a wide variety of conditions which affect the way you feel and think. It can also affect your ability to get through day-to-day life. Mental illness can be influenced by several different factors, including genetics, environment, daily habits, and biology. Number 2. Common mental health problems such as depression and anxiety affect 1 in 4 people, but it's still something that lots of people find hard to talk about, which can mean that many people keep their feelings about having a mental health problem a secret, even from close family and friends. You can't always tell if someone has a mental illness. People might look as though they're fine and doing well, when actually they're silently struggling. If someone has bipolar disorder, they may show significant mood swings or appear more withdrawn if they're dealing with self-harm or negative thoughts. But everyone is dependent on the individual, and there is no way to know whether someone is unwell. Number 3. Here are some suggestions for how you can help people living with anxiety and depression. Encourage them to seek help. Perhaps the most important thing you can do is encourage them to seek appropriate treatment. You can reassure them by letting them know that help is out there, and you will be there to support them. Don't be afraid to bring it up. It takes a lot for someone to say, "I need help," but it doesn't hurt to raise the subject yourself. Try to be open about depression and difficult emotions, so they know that it's okay to talk about what they're experiencing. Sometimes, you don't have to explicitly talk about mental health to find out how they're doing. It can be as simple as texting them to let them know you're thinking of them, or suggesting that you could go out to dinner or for a walk. Don't blame them. Try not to blame them for feeling anxious or depressed, or tell them to pull themselves together. They are probably already blaming themselves, and criticism is likely to make them feel even worse. Someone with depression may get more irritable and be more liable to misunderstand others or feel misunderstood than usual. They may need reassurance in some situations. Look after yourself. Your mental health is important too, and looking after someone else could put a strain on your well-being. If you're able to stay well, you're more likely to be able to provide good support for longer. This could include trying to stay healthy and physically active, confiding in someone other than the person you're worried for, taking a break from time to time, and being realistic about what you can and can't do for yourself. Mind has lots of advice on helping someone else. Number 4. In 2017, 5,821 people committed suicide in the UK, and every one is a tragedy. Suicides are not inevitable. They can be prevented with the right support in place. It's essential that services are able to respond when people reach out. From early treatment to help people manage their mental health problems as soon as possible, to crisis care services that can step in when someone becomes acutely unwell. If you're feeling suicidal or are concerned about someone else, confide in someone you know. Contact your GP, call 999, go to A&E or call the Samaritans, 116-123. You can also find more information on the Mind website through Mind's confidential info line, 0300-123-3393, or you can text 86463. Number 5. If you are sectioned, this means that you are kept in hospital under the Mental Health Act of 1983. There are different types of sections, each with different rules to keep you in hospital. The length of time that you can be kept in hospital depends on which section you are detained under. What will happen to you once you are sectioned depends on which section you are detained under, your specific mental health problems and need for care and treatment, and your personal circumstances. Number 6. If you have been diagnosed with a personality disorder, it doesn't mean that you're fundamentally different from anyone else, but at times you might need extra support. The word personality refers to the pattern of thoughts, feelings, and behavior that makes each of us the individuals that we are. These affect the way we think, feel, and behave towards others and ourselves. We don't always think, feel, and behave in exactly the same way. It depends on the situation we are in, the people with us, and many other things. But we mostly tend to behave in fairly predictable ways. Personality disorders are a type of mental health problem where your attitudes, beliefs, and behaviors cause you long-standing problems in your life. Your experience of personality disorder is unique to you. However, you may often experience difficulties in how you think about yourself and others. You may find it difficult to change these unwanted patterns. Number 7. The term PTSD is used to describe a range of psychological symptoms which can follow traumatic events. PTSD can be triggered by anything that consciously or unconsciously reminds an individual of a specific trauma in their lives. For some people, this is a single major significant event, such as a car accident, and for others, an ongoing series of events, such as being in conflict zones or experiencing abuse. Symptoms of PTSD don't necessarily emerge straight away, and in some, don't develop until many years after the event. They can include vivid flashbacks, nightmares, lack of sleep, and feeling emotionally cut off. PTSD is surprisingly common. As much as 10% of the population will experience it at some time in their lives. If someone has been living with distressing symptoms for over a month after a traumatic event, they should see their GP, who can refer them for specialized help. Effective treatment does exist, and you can recover from PTSD. Number 8. Different people will find that different treatments help to manage their mental health, whether this is medication or alternate methods such as talking therapies, exercise, or a mixture. While antidepressants can be effective for some, they are not the solution for everyone and are generally not recommended as a first-line treatment for mild to moderate depression. Anyone taking antidepressants should be made aware of the possible pros and cons for them, and they should have their treatment reviewed regularly. Talking therapies such as cognitive behavior therapy, or CBT, and counseling are becoming more widely available as part of the Improving Access to Psychological Therapies program. Giving people a choice of treatments is key, whether that's drugs, talking therapies, or alternatives such as art therapy or exercise. Number 9. Evidence suggests there are 5 steps you can take to improve your mental health and well-being. Trying these could help you feel more positive and able to get the most out of life. Connect with other people. Good relationships are important for your mental well-being. They can help you build a sense of belonging and self-worth, give you an opportunity to share positive experiences, provide emotional support, and allow you to support others. There are a lot of things you could try to help build stronger and closer relationships. The do's. If possible, take time each day to be with your family. For example, try arranging a fixed time to eat dinner together. Arrange a day out with friends you have not seen in a while. Try switching off the TV, or talk or play a game with your children, friends, or family. Have lunch with a colleague. Visit a friend or family member who needs support or company. Volunteer at a local school, hospital, or community group. Make the most of technology to stay in touch with friends and family. Video chat apps like Skype and FaceTime are useful, especially if you live far apart. And the don'ts. Do not rely on technology or social media alone to build relationships. It's easy to get into the habit of only ever texting, messaging, or emailing people. And number 10. One of the most important things to do if you're feeling down is to open up. Most people feel more comfortable confiding in a close friend or family member in the first instance. Often, simply talking about it helps. If the problem continues and begins to interfere with everyday life, you can speak to your GP, who can talk you through the support that's available. Thank you for watching, and please don't forget to like and subscribe, and follow on our Instagram for more suggested content and things you want to hear.